Well, we're certainly concerned that these new variants are more contagious. That means this virus will spread further and faster, and that could indeed prolong the outbreak. Now, we're in a bit of a race between these variants and the regular viruses and the vaccination. We still could get ahead of the virus if we had enough vaccine and we vaccinated enough people. I'm still cautiously optimistic that we can win this race by the end of the summer and have vaccinated enough adults so that maybe we could put our masks aside and return to something that's near normal. This COVID changes almost daily, so my prediction is a cautious one.
Okay. I guess just in general, how worried are you about the new variants?
Well, of course, I am concerned because they are contagious. And the more virus that's spread out there, the more people will become sick. The more sick, I think we'll have more hospitalizations. And there's also the sense that at least the British one can now make you more seriously ill when you do get infected. So none of us like to hear that news.
Okay. You touched upon it, but I guess I just want to drill in on how important is it that we move with speed now in terms of getting people vaccinated?
Well, it's very important that we move rapidly to get people vaccinated because we're in a race with the virus and particularly these new variants, which are more contagious and can spread to more people. So we'd like to get ahead of the virus finally by vaccinating a lot of people as quickly as possible.
Okay, and I know that a lot of people don't want to think this way, but let's face reality as it is. Should we be changing our expectations that this pandemic will be over soon?
Well, those of us in infectious diseases have been trying to tell people this virus is not going to disappear. We're going to have to live with this virus. We would like to blunt it and get the transmission rate really down. You know, we live with influenza. We likely will be living with COVID. And I wouldn't be surprised, to make a gentle prediction, that on an annual basis, we get the flu shot in one arm and the COVID vaccine shot in the other arm in order to keep ourselves up to date in our protection against both of these sets of viruses.
Okay. And another thing that people don't really want to hear, but could we see another surge if these variants take off?
Oh, we're really worried about that. Yes, we could see another surge. The CDC predicts that the British variant alone may become the dominant strain by the end of March. That means an awful lot of spread. If there's a lot of spread, some of those people are going to be seriously ill and require hospitalization. Yeah, that could happen. That's why we're trying to get out there with the vaccine, to get out there to keep up with and even get ahead of this virus.
So I guess going off of that, I think a lot of people are seeing the numbers come down in various places around the country. And it already seems to me like people are willing to let their guard down, though the numbers are still quite high. What would you say to people about their behavior as we move into perhaps the spring season?
I know we've seen the cases come down. I'm very excited about that, and I have to tell you, I don't completely understand it, but my answer to everybody is caution, caution, caution. Keep up the caution. You know, we've done this before. We've come out of hiding, as it were, before, and gone about our affairs in a near normal way, and then you get another burst of cases. We've been on a roller coaster with that. Hang in, everybody. The cases are coming down. Let's keep driving them down by wearing the mask, social distancing, and getting vaccinated just as soon as you become eligible for it.
Okay, my last question is, how does the spread of the coronavirus overall also create more variants? Like, how do you explain how that happens?
Viruses mutate. They create these variants every time they multiply. And of course, they multiply millions of times as they spread from one person to another. If we can reduce their spread, we reduce their opportunity to multiply and mutate. So that will keep down the creation of new variants.